Good morning. So our consult with me today is about a question we get asked all the time, and I work for you, and I still sometimes forget the answer and get it a little mixed up. What is the difference between full, partial, and radical hysterectomy?
It's a good question because there's a lot of confusion for patients. They often refer to as a total hysterectomy as being removing the uterus and removing tubes and ovaries. The word hysterectomy refers to the uterus itself. So if all of the uterus is taken out, then that's a total hysterectomy. If the cervix is not taken out, but the body of the uterus is taken out, that's called a subtotal or a supracervical hysterectomy.
Okay,
that has nothing to do with tubes and ovaries.
Okay,
that's a separate definition, which is in the case of the tubes, it's called a salpingectomy. That's when the tubes are removed, or an oophorectomy, which is removal of the ovaries.
Yes.
So does that answer the question?
Yeah, okay. So what is it when everything is pulled out through the vagina?
That's a total hysterectomy.
But it's done laparoscopically as well.
Yeah, so you'd refer to it as a laparoscopic total hysterectomy.
Hysterectomy.
Yeah.
And that's tubes?
No, it has nothing to do with the tubes and ovaries.
Okay.
By definition, it doesn't.
So it'd be a total laparoscopy with oophorectomy?
No, total hysterectomy done laparoscopically. Or refer
with
to it
oophorectomy?
with salpingioophorectomy. So you make that one even more complicated.
This is where we drive the people at Cottage Hospital crazy with these words.
It's really pretty simple, okay? When you're talking about hysterectomy, you're talking about uterus. The only variation in that theme is whether the cervix is taken out as well. So a total hysterectomy includes the uterus, the fundus of the uterus, and the cervix. A partial hysterectomy would actually be removing the body of the uterus and leaving the cervix, but that's not really how specific we are when we're talking about a supracervical hysterectomy or leaving the cervix, because it's just a little confusing otherwise. And then separately to that, the tubes and the ovaries being removed, or are they just being moved on their own without the hysterectomy?
Why do people leave the tubes and the ovary? What ovaries? Now, if they're menopausal patients, what's the point?
There really isn't much. So the ovaries work up until menopause, and then they pretty much quit. And so removing the ovaries after menopause is not going to make much difference to the patient, really good or bad. You would think that removing the ovaries may reduce the chances of ovarian cancer, but there's not a lot of evidence to suggest that. However, what's come up recently is the discovery that a lot of ovarian cancers start in the fallopian tubes. So when we're doing a tubal ligation, for instance, for sterilization, we would tend to remove all of the fallopian tube now, as opposed to just what the phrase that was used before was tying the tubes.
Yeah.
But that gets into another subject.
Okay. Wow, so I didn't know that. So ovarian cancer, they think starts in the fallopian tubes?
A lot of them, not all of them by any means.
Okay, so what happens?
A lot of times when we take the ovaries out because there's an ovarian cyst or there's some problem, particularly for a postmenopausal patient, we would take the tubes as well and not necessarily take the uterus out because there's nothing wrong with the uterus, and the surgery for a hysterectomy is a bigger surgery than just taking the tubes and ovaries out. So each case is just individually tailored for the patient's needs and age.
But if you're a patient that is, you know what, I want to remove all these scary female risks, ovarian, uterine, cervical.
Right.
Total hysterectomy.
Again,
with the
total hysterectomy doesn't have anything to do with the tubes and ovaries.
Okay.
It has to do with the uterus. And it would be the body of the uterus and the cervix. That's a total hysterectomy.
And then if they wanted to remove the ovaries and the tubes.
That can be done separately. Now, what's the point?
But same surgery.
Yeah, the same surgery. Yeah. And the reference to a laparoscopic procedure or a robotic procedure is all a definition in how it's done. So there are basically putting it simply, there are 4 ways of doing a hysterectomy. You can do a total laparoscopic hysterectomy. You can do a laparoscopic supracervical hysterectomy when you take out part of the uterus and leave the cervix. You can have a robotic hysterectomy, which can be any of the same definitions as the laparoscopic.
Okay.
And then there's a vaginal hysterectomy, where everything's done through the vagina and no incisions in the abdomen at all. And that's a procedure that's coming back more into favor now, because it is really a minimally invasive procedure and the recovery is a little quicker. But it's technically more difficult than a total abdominal hysterectomy, where a bigger incision is made.
But that's
in the
probably
abdomen.
the safest way to do it, is through the vagina.
No, in my opinion, the safest way is to do it laparoscopically.
But if you can't get everything out that way and intact.
Yes, you can do a
safely.
modified or laparoscopically assisted hysterectomy, where we have the benefits of the incredible visibility with the laparoscope or with the robot, and then we basically detach the uterus from its blood supply and nerve supply and the fibrous tissues that hold the uterus in place. You do all that laparoscopically, but if it's too big to come out through the vagina at that point, then you need to make a bigger incision abdominally to take
Which
it
is
out.
what people want to avoid.
Yeah, in the not too far away old days, we had an instrument called a morcellator, which basically cut the uterus up into smaller pieces to allow us to do that laparoscopically without a big incision. So there's a lot to sort through in all of those terms. But the real point from the beginning was, what's the difference between a total hysterectomy and does that include taking the tubes and ovaries out? And the answer is no. It's a separate diagnosis or a separate procedure.
Okay.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.